and EMR. We're going to cover these, and then at the end of the session, we'll do like an interactive question and answer period. So, you know, if you want to ask a question in the meantime, you're more than welcome to type it in. Other than that, we're going to unmute everyone at the end of the session, and we can have a discussion or question and answer period afterwards. So topic number 1, ICD-10 and EMR. Currently, if you're not using, there is a billing interface between your Medisoft Clinical and Medisoft, or between Lytec MD and Lytec. From what we've seen from working with you individually, not a lot of the offices are using it. With ICD-10 being in effect, we recommend that you do, because when a provider picks a specific code in Medisoft Clinical or in Lytec MD, that code, even if it doesn't currently exist in Medisoft or Lytec billing portion, will transfer over and get correctly mapped to the right ICD-10. So if the provider in their progress note picks, you know, a specific code for the right limb for an initial encounter, and that's a very specific ICD-10, if that ICD-10 does not yet exist in your Medisoft or in your Lytec billing portion as a code, when the provider picks it in the note, if you use this billing portion, or if you use this bridge interface between the billing and the EMR that we discussed with you today, that code is going to be sent over to your Medisoft or Lytec, whichever one you're using, so that you won't have to add it, or you won't have to purchase codes on disk or Encoder Pro if you don't already have those in place. Okay? All right, so in order to achieve this, it all starts within a progress note. A provider has to make sure that in order for this electronic encounter form to get generated, they have to have a procedure and diagnosis in their notes. An electronic encounter form is your electronic super bill. That gets generated directly from what the doctor puts into the notes. So any procedure codes, any diagnosis codes that the provider selects in their progress note are created and transferred onto that electronic encounter form, which we then send over to Medisoft or to Lytec, and the biller can use to bill out those codes. So in order to even get this electronic encounter form or this electronic super bill to be generated, we have to make sure that we have a procedure and a diagnosis code selected in the progress note. It is crucial that you have a procedure selected, because without a procedure code, it won't get generated, so that will probably fall through the cracks and you won't be able to bill out for it. So make sure that the provider picks a procedure code. For the diagnoses, unless you have updated your pick list for the diagnosis codes within your progress notes, what you can use is a PBDX icon up at the very top. So you're going to see at the top of your Medisoft Clinical or Lytec MD, there's a PBDX icon, and you can use that to search for codes. When you insert a code using that problem or diagnosis button, it's going to insert in a format that's highlighted in the red frame here below. It's going to list your ICD-9 code along with your ICD-10 code. Okay, and it's going to do so for all of your codes that you select. So if this particular ICD-10 code does not yet exist in Medisoft or in Lytec, when you transfer this electronic encounter form from your Medisoft Clinical or from Lytec MD, that code is going to get created in your Medisoft or in your Lytec billing portion. We're going to see that. In a few moments. Okay. So what you're going to notice is that as you're using this PBDX button, you're going to have a search window, and you can use the search window to locate the codes by either the code, or you can use a search window to locate the codes by word. So if you know the original ICD-9, you can type that in, and it will provide you a matching ICD-10. If you only know the description, and that's probably more for providers, if they only know a description that, you know, it's a pain in the limb, they can go ahead and type that in rather than the code, and the system will still find the matching ICD-10 code for it. One thing to look out for is that as you're looking for these codes for the previous ICD-9s, whether you're looking for them, you know, with the previous ICD-9 or whether you're looking for them by a description, you'll see that you have a description and you'll have an ICD-10 and an ICD-9 column. So one thing to look out for is that if you have an ICD-10 column, and in that column you'll see sometimes you'll see several codes listed. That means means that the code that you're selecting, that original ICD-9, is no longer a one-to-one mapping. So for example, in this case, the 729.5, which was previously a single code that was specific for pain and limbs, is now branching out to multiple ICD-10s, which I see in this column here. But also when I click it and select it, I also see the multiple ICD-10 codes in here. Okay, so the system, whether it's Medisoft Clinical or Lytec MD, whichever one you're using, is going to prompt you to be very, very specific and narrow down which ICD-10 specifically you want to use before you're able to click on OK. You're going to see that this OK button here is grayed out until you pick a specific code from this section right here. Sorry for my very accurate drawing skills. Okay, so it's going to ask you to be very, very specific. It's like I said, it's okay if you don't yet have that code in Medisoft, because if you're using this billing integration between Medisoft Clinical and Lytec MD, it's going to carry over and it's going to transfer there. Okay, so in this example, I'm looking for a code by typing in the previous ICD-9 code. In the following example, you will see I can look for it by, or I don't actually have it, but like I said, you can also look for it by description if you want. So you can look by codes, whichever way you prefer. Okay. What will happen afterwards is when the doctor is done with the note and they sign it, there's going to be that electronic superbill generated that I mentioned before. It's called an electronic encounter form, and to find it within your Medisoft Clinical or within your Lytec MD, go to Task and then Electronic Encounter Forms. The Task menu is all the way at the top. It's one of those, small font menus. Click that, and then when you select Task, go to Electronic Encounter Forms. You will get a list of all of the encounter forms that have been created for either today or the previous dates. They're by patient, so they're going to be individual superbills or individual encounter forms for each patient. What you will do then is open one up, and you will see a list of diagnoses and a list of procedure codes. You may have one diagnosis, or you may have one procedure, you may have multiple procedures, depending on how many the provider picked within that progress note. Everything that you see in the encounter form is extracted from the patient or from the patient's progress note. Okay, what you will want to do then is on the right-hand side you have the diagnoses. On the left-hand side you will see that you have only procedures. So what you'll want to do then is select the diagnosis and drag it under the procedure that you want it to fall under. So in this case I've already done it. So I have my procedures or my diagnoses listed under each procedure. And then once you're done matching the procedures and the diagnoses, you have to check the complete box. When you check the complete box, that means that you've matched up your codes. When you click on OK, that encounter form is then going to transfer over to Medisoft or to Lytec, depending on what billing software you use. Okay, so again, match up your diagnoses to fall under the procedures that you want them under. You can use the arrows on the left and on the left here up and down to arrange the procedures in order of priority. So which one's primary, which one's secondary procedure. And then once you're done matching them, you can click the complete box, click OK, and that will send your encounter form over to Medisoft or to Lytec. Okay. Now I'm going to hand this portion over to Justina so that she can explain to you what you're going to see or what you can expect in Lytec. And again, like I mentioned before, keep in mind that the code that the provider selected within Medisoft Clinical may not yet exist in Medisoft. So this is what's going to happen, and this is how it's going to get added. Justina, go ahead.
Okay. So as Vida mentioned, once you click complete and then press OK on that electronic encounter form in your EMR, the bridge will transfer over all of those codes into Medisoft. Okay. So what you're seeing on the screen here is the unprocessed EMR charges screen within Medisoft. So anytime you complete your electronic encounter forms, all of those electronic superbills will get filed into here. So in Medisoft, you can open this by clicking on unprocessed transactions and then unprocessed EMR charges. Okay. So what you're seeing on the screen here are the codes that came over from Medisoft, but you can notice that the code is actually the ICD-9 code with the letter A at the end. Okay, so in our EMR, we had the ICD-10 code, which for 729.5 pain and limb was M79.661, and for our other fracture code, which was 813.42, we have the ICD-10 as S52.501D. Okay, so when these codes came over into Medisoft, rather than them being the ICD-10 code, what Medisoft did was it created the code as an ICD-9 with the letter A at the end. Now, don't get confused. It doesn't really matter what the code is. You will see on the next screen that hidden behind this code is the ICD-9 itself without an extension and the correct ICD-10 code. Okay? So if you're seeing your ICD-9 codes with an extension, that's okay. And you may be seeing more than one letter. You may be seeing B, C, or D, because based on how many codes Clinical has when you search for them in your diagnosis search, there may be up to that many letters. Okay? So on the next screen, here we posted that electronic encounter. Okay? And when I clicked on the ICD or the code that came over from Clinical, which was our ICD-9 with the extension, we can notice that there's an ICD-9 column, which, like I mentioned, contains just the ICD-9 code, and then there's an ICD-10 column, which contains the correct ICD-10 code, which is M79.661. That's the code that's going to be transmitted on your electronic claim, or if you're printing it, that's the one that will print. Okay, so what's happening essentially is that Medisoft did not recognize M79.661 when it was sent over from Clinical, so it added it into your list for you as an ICD-9 with an extension so that it's still recognizable in some way to you, and then it was able to match the correct ICD-9 from Clinical, and then it also added the ICD-10 code for you into Clinical. So you don't have to manually add in the ICD-10 code in order for you to be able to bill for it. Okay? It's actually helping you out. If you wanted to see the ICD-10 code, then you would actually have to go into your list, diagnosis list, and manually add in the ICD-10 code. You would want the default code to be the ICD-10 code. You can place the same existing ICD-9 into your ICD-9, and then you can retype the ICD-10 into the 10. So kind of just want you to understand that what the code is, it doesn't matter. It can be A, B, C, D. What matters is the code that's listed in the ICD-9 column and the ICD-10 column. And then based on what your system is set to bill for, most of your insurances right now should be set to submit the ICD-9 code for claims with a date of service prior to 10/1, and the ICD-10 code with claims for claims with a date of service on 10/1 or after. Okay, so now we're going to move on to the second topic, which is meaningful use in 2015, new and improved. So if you haven't heard, the proposed rule with CMS has been passed. So there are quite a few changes that have been made to meaningful use in 2015. The first is that the reporting period has been shortened to 90 days. So you'll have to choose a set quarter again, and most of you, oh, okay, I'm sorry, it won't have to be a set quarter. It can be any 90 days. But most of you, if you don't have the portal or if you've been late on the portal, probably aren't able to meet any of the 90-day periods before the last quarter. So most of you will probably be using October through December. But if your reports look good for any 90 days before that, then you are more than welcome to use that time period. The only thing is you won't be able to attest until after January 4th, 2016. CMS isn't ready on their website to begin attestation before that. Okay. So now along with the reporting period being shortened, the core objectives for meaningful use also became compressed. So one of the first objectives is Cpoe, which was an existing objective in the previous core objective set. So you cannot exclude from this one unless you have less than 100 orders. And Cpoe is comprised of 3 different parts. There is Cpoe stands for computerized physician order entries, for those of you that don't know. And there are 3 separate objectives within this one, and those are for medication orders. So you have to meet a threshold of 60% or more, so actually it should be 61%. Lab orders, a physician should have to place at least 31% of lab orders in the system, and then the physician should place at least 31% of radiology orders in the system. Okay? So unless you place less than 100 orders for any of those 3, you cannot exclude from them, and you must meet the threshold. Okay? And that also existed, like I said, in the previous core set. The second one is e-prescribing. So you should e-prescribe at least 51% of your medications, and you can only exclude if you have prescribed less than 100 medications in the reporting period. You also want to make sure that your drug formularies are working. Okay. The third one is clinical decision support rule. So anytime you open up a patient's chart, you should be seeing that health maintenance reminder. Okay, 4 of those reminders should be relevant to a clinical quality measure. If you don't have that set up, or if you're not sure, then let us know and we'll check that out for you. That's not something that's actually going to be run on the report. It's something that we want to capture a screenshot of within the reporting period and save into our meaningful use folder so that we can use it in case of an audit. Number 4 is portal. So 50%, this is a huge change actually. All the other ones existed in the previous core set. The portal has changed in 2015. So 50% of your patients will still need access to the portal. That means you need to create a user ID and a password for them. However, the other 2 parts to the portal objective have changed. So previously, you had to have 5% of your patients log in and view their health information in the portal. Now they only want to see that one patient logged in into the portal and viewed their information. In addition, one patient sent you a message. It can be the same patient, or they can be 2 different patients. They just want to see that at least one patient logged in and at least one patient sent the provider a message. Okay. Previously, the messages objective was also a 5% threshold. Keep in mind, in the future, CMS is going to start raising this threshold. It's just that in 2015, a lot of providers felt that they didn't have enough time to get their patients started with the portal and then have them log in and send a message. So they're giving you a little leeway in 2015, but going forward in 2016 and 17, they're going to be raising these thresholds. So it doesn't mean that just because you got one patient in the reporting period, you should stop there. Keep having your patients log in. Keep encouraging them that it's important for them to log in and view their information, and encourage them to also send messages to the doctor regarding any information or questions that they may have. The doctor doesn't have to respond to the message, but the patient has to at least send the doctor a message, and then you can have someone else respond. It may be a message that doesn't require a response. Okay, the 5th core objective is the security risk assessment, also unchanged. So you want to perform the security risk assessment on your server and your whole system within the reporting period. Save all that documentation in your meaningful use folder. You're just going to be attesting yes or no to this question. You're not going to have to prove it on the report either. Patient education, number 6, remains unchanged as well. So you need to give at least 11% of your patients patient education. Number 7 is medication reconciliation, also unchanged. At least 51% of your patients need to have medication reconciliation performed. Number 8 is health information exchange, which is our direct messaging. We're going to talk a little bit more about this one in just a bit, but at least 10% of your patients, or 11% actually, should have their health information sent to another provider via email It has to be a secure email. Okay, and number 9 is the public health objective. You must attest to 2. Below are listed a possible choice of 6. So the first is immunization registry. Second is syndromic surveillance reporting. You can do case reporting, public health registry reporting, clinical data registry reporting, or electronic reportable laboratory reporting. You want to check with your state which ones they're accepting electronic information for. Almost every state, I would say, is ready to receive immunization information electronically. So if you do administer any immunizations, then you will have to do that one. And then check on your state's public health registry website to which other ones you may want to do or can do. If you don't do any of these and you want to check the detailed rules to make sure that you actually don't do any of them, then you can exclude from them. Okay, so here are the objectives that were removed from the previous core set, but they're still required to be met. So you still want to be recording demographics, even though you're not going to be running it on the report or submitting this during attestation in 2015, that information will still need to be available to the patient in the portal. Okay, so if you stop collecting demographics or vital signs or smoking, then you're actually not going to be meeting the portal objective, because the portal objective in the detailed rule states that the patient needs to have access to all this information in their portal. Okay, so now we're going to move on to topic 3, and I'm going to hand it back over to Vida.
Okay, so one of the objectives that Justina focused was direct messaging or health information exchange. Just to give you a little bit of insight in what that objective is it requires that every time you refer a patient out to a specialist, it doesn't matter if it's, a vascular surgeon, a neurologist, an internal medicine provider, every time you refer a patient out, you're supposed to provide them with a summary of care records, so pretty much a summary of their chart that they can take to the provider you're sending them to with them. That requirement used to be that you would be able to either print it or maybe, put it on a flash drive for a patient, and then the patient can take it with them. It no longer satisfies the rule if you're doing it on paper. From this point forward, and this is something that's going to continue growing in percentage and increasing, these chart summaries need to be transmitted electronically. So in order to do that, or in order to accomplish this objective, you need to have an email address that is HIPAA compliant, HIPAA secure. You can't just send an, patient's chart summary information via Yahoo or Gmail or a Hotmail account. It has to be something that you're able to do directly through your Medisoft Clinical or through Lytic MD, and we have to obtain these from McKesson. So the way that this objective works is when you're done and configured for this objective, you have a secure HIPAA compliant email address that is unique to your provider, and that provider's this email address is entered into Medisoft Clinical or into Lytic MD, and as you're referring a patient out to a different specialist, you're able to send a chart summary to a provider that you're sending the patient to using that secure address directly out of your Medisoft Clinical or Lytic MD. Now, in order for this to be accomplished, obviously the provider that you're sending the summary to needs to have this address as well, and this is actually a requirement in Meaningful Use for 2015 that you need to be able to test not only with a different provider outside of your practice, but also with a different EMR. So you're going to have to send it to someone, if you don't have an actual patient, you're going to have to send it to someone maybe as a test, and we can help you out with that, but this needs to be accomplished. Before the change of the rule, CMS mentioned some possible exclusions, like if you refer out less than 100 times. If you look through the final proposed rule that just came out last week, they don't mention any of these exclusions anymore. So this is something that, out of the total number that you're referring, your 10% is going to have to be sent out electronically. Now, in order to, like I said, achieve this, we have to get a secure HIPAA-compliant email address from McKesson. So that is something that we can fill out for you and we can submit it. However, before they give us this email address, they will contact someone from the practice, a designated point of care or a designated point of contact, and they'll ask you to go through a verification process. This verification process, because these secure email addresses you're getting through McKesson, but you're getting them from SureScripts, so McKesson and SureScripts have partnered up on this. You're going to be contacted by a SureScripts representative who's going to ask you some personal information. It's going to be a series of 4 questions generated by a credit check company called Experian. And so what will happen is, in order to get this direct email address, you're going to have someone in your practice, a designated point of contact, is going to go through a credit check. Neither SureScripts nor McKesson nor MicroWise will have that credit check or will be able to view it. It's just something that SureScripts needs to do in order to meet the National Institute and Standard of Technology level of assurance. So that's something that's a requirement. It's about a 10-minute process, but I know I wanted to bring this up because practices that are already going through this have been getting phone calls and are very reluctant to provide this personal information or to go through a verification process. And I just wanted to stress how important this is, because without going through this verification process, we will not be able to set you up for direct messaging. If we're not able to set you up for direct messaging, you won't be able to achieve or attest to meaningful use. And if you can't do that, then you're going to start getting penalties from Medicare for not participating, or for participating and not being able to meet it successfully. So slowly but surely, we're going to start enrolling everyone with, with this direct messaging objective, and we may set you up for it and not let you know that we send the point of contact to McKesson. So if you get a call from SureScripts and they're asking you to run through a credit check, it's not a prank phone call. It's something that they actually have to do in order to give us that certificate that will allow us to set you up for this objective. Okay. So that's all the information that we wanted to cover for today. What we're going to do now is we're going to open up the floor for question and answer. So if you have questions, feel free to speak out or raise your hand, and then we will unmute you.